Hospitals have been sounding the alarm that this latest round of COVID is overwhelming the system. Staff are falling ill, but after almost 2 years, they're also burnt out. Here's one nurse's account of just how bad it is and the emotional toll it is taking.
You don't want to leave that patient because you know they're going to die in that room by themselves. So you just kind of sit there, and it's very lonely.
Nancy Halupa has been an ER nurse for the past 23 years. After working through COVID, she says she now has nightmares.
For me, it's that look they all came in with when they couldn't breathe. And it was a look of fear in their eyes that you just you can't forget. They weren't struggling to breathe. It wasn't like your typical respiratory arrest. They were very calm, except for this look in their eyes. It was just not something I want to see again.
Nancy, are you okay?
Some days, this has been a hard week, and it's stupid because I got sick while I was at work. And I'd spent all of New Year's in my bedroom, kind of quarantined, even though my tests were coming back negative.
It is the sheer exhaustion of more patients and fewer nurses. In August, Nancy started an online campaign inviting other nurses to share their stories. Here's a sample. I've been a nurse since 1992. I can't go on. We need help. The surgical unit has 2 nurses for 17 patients. New grad RN put in charge because nobody else to call. I just worked 16 hours. We were still 5 nurses short.
We are on fire. And what kills me is that we've been warning people, and we've been saying this for months.
The straw that is breaking the back for so many, according to Nancy, is the Ford government's Bill 124, which caps their salaries at a 1% increase, which is below the rate of inflation. What makes it even worse, she says, is she's working alongside private agency nurses who are making more money than she is.
They make double what I make.
What?
They are paying $85 an hour for nurses to come and work in an emerge or an ICU. I make 47. So if they're getting paid 85, that agency's got to be making way more than that. So what does that tell the nurses that are actually staff members of the hospital?
In this statement to CityNews, the Ontario Hospital Association confirms the use of temporary agency nurses to fill staffing shortages, noting there has been, quote, an extraordinary increase in billing rates paid to agency staff and, in turn, charges to the public, adding the escalating costs are of great concern. It is a bitter pill for Nancy, but she just can't bring herself to quit the job she has always loved.
I liken this profession to being in an abusive relationship. You know you shouldn't be in it anymore. You know you've hit your wall and you should quit, but you just can't walk away.
Today, the leaders of the NDP, Liberal and Green parties joined union leaders calling on the Ford government to repeal Bill 124 and at least give healthcare workers the cost of living. That's unlikely. Those calls began before the pandemic did.